Up first this evening, health officials are discussing whether to provide security for the nurse who administered the AstraZeneca vaccine to senior journalist Michael Sharpe. Mr. Sharpe was hospitalized 10 days after getting the vaccine, but since his death on Tuesday, threats against the nurse have skyrocketed, forcing authorities to urge calm. Giovanni Dennis reports.
A sharp fallout. A moment that started with smiles and warmth is now causing pain and sadness. 10 days after getting this shot of the AstraZeneca vaccine, Michael Sharpe was hospitalized. He died Tuesday. And now, the nurse who administered the vaccine is now a target and has been since March 14.
Since his admission in March, the nurse has been getting on and off threats saying that it is the fact that he got the vaccine why he has been admitted. And then yesterday, when news came of his passing, these threats became more and more threatening and more dangerous.
More dangerous because they're death threats, and the perpetrators are blowing up her personal phone.
She got text messages, persons accessed her phone. I don't know how they got her number, but they have been calling her. And, they have been accusing her of causing Michael's death.
Mrs. Edwards Henry finds the threats unfortunate, and the nurse in question is now petrified.
She is crushed. She is demotivated. She feels as if all her work that she has done is all for naught. She was on the verge of tears when I spoke to her yesterday.
The threats have caused a fallout among nurses who feel demotivated. There are also discussions over the safety of the nurse.
I spoke with the permanent secretary yesterday. I spoke with the chief nursing officer in the Ministry of Health yesterday. And that was something that came out. It is, I know, being discussed at that level. And if there becomes a need for security, I'm sure that the Ministry of Health will put that in place.
The health minister in Parliament Wednesday condemned such actions.
Those members of the public who are so inclined or motivated to refrain from spreading false information and worse, verbally attacking healthcare workers who have done their jobs to date with distinction.
Dr. Tufton said people against the vaccination are looking for any reason to support their movement.
The issues around persons who have died having taken the AstraZeneca vaccine, and the links between the vaccine and death have featured prominently with a certain degree of venom by those who are looking for a reason to promote the anti-vaccine movement. And I want to just ask persons to desist and all well-thinking Jamaicans to condemn those efforts.
Speculations about the cause of Mr. Sharpe's death have been rife, with people seeking to make a connection with the vaccine. The exact cause of Mr. Sharpe's death is not yet known, although he declared that he was a heart patient. Giovanni Dennis, TVJ News.